So starting with glaucoma. So just like the definition says, it is a group of optic neuropathies, okay, characterized by progressive degeneration of retinal ganglion cells and their axons, leading to characteristic optic nerve head changes and visual field loss. It is often associated with elevated intraocular pressure through normal tension glaucoma exists, though normal tension glaucoma exists. Okay, so this is the definition in the namge ಏನು ಅರ್ಥ ಆಯಿತು. Basically there is a group of diseases which is affecting nerve, okay, and the nerve which is supplying for vision is optic nerve. So there is a group of optic neuropathies, basically disorders of optic nerve. So ಈ ಡಿಸಾರ್ಡರ್ಸ್ ಇಂದಾಗ ಏನಾಗುತ್ತೆ, there will be degeneration of the retinado ganglion cells and their axons. Okay, so this will lead to changes in the optic head. Optic nerve the head ಏನಿರುತ್ತೆ ಅಲ್ಲಿ changes ಬರುತ್ತೆ, because we know from the retina, this is the retina, and from here there will be optic nerve, right? So if there is degeneration happening in these retinal ganglion cells and their axons, ultimately it will reflect in optic nerve head. So that is what is happening. There is a group of optic neuropathies which is affecting, which is leading to progressive degeneration of retinal ganglion cells and their axons, leading to optic nerve head changes. And since there is optic nerve head change, there will be impaired perception of vision, and that is leading to vision loss. Okay, and there will be increased intraocular pressure. ಕಣ್ಣೊಳಗಡೆ ಪ್ರೆಷರ್ ಜಾಸ್ತಿ ಇರುತ್ತೆ ಯೂಶಲಿ in cases of glaucoma, but there is glaucoma where this intraocular pressure is normal, but still all these changes like optic nerve neuropathy and retinal cell ganglion cell and their axons being damaged and optic nerve head getting changes, all these are there even when there is normal intraocular pressure. So you just can't remember like glaucoma andre intraocular pressure ಜಾಸ್ತಿ ಇರೋದು ಅಂತ. You can do it for a crude method, but there is normal tension glaucoma also in which intraocular pressure is normal. Okay, so what we need to understand, there is two types of glaucoma mainly. There is open angle glaucoma and closed angle glaucoma. Okay, so before we understand that, we will have to know the drainage of the aqueous humor. So aqueous humor andre eno, the fluid of our eye, basically just like CSF in our brain, there is fluid in our eye, that is aqueous humor. Okay, from where is it produced? It is produced from the ciliary processes. Once these are produced from the ciliary processes, they will reach aqueous in the posterior chamber through the pupils. Okay, so ನಮಗೇನು ಗೊತ್ತಿರಬೇಕು ಡಿಫ್ರೆನ್ಸ್ ಅಂದರೆ, ದಿಸ್ ಇಸ್ ಲೆನ್ಸ್, ಇಲ್ಲಿ ಜಾನ್ಯೂಲ್ಸ್ ಇರುತ್ತೆ, be holding the lens. Okay, and then we all know there will be iris here and ciliary body, then it will continue as choroid. Okay, so in the anterior part of the eye itself, okay, so this is the anterior part of the eye. ಲೆನ್ಸ್ಗಿನ್ನ ಮುಂದೆ ಇರೋದು, ಆ ಲೆನ್ಸ್ಗಿನ್ನ ಮುಂದೆ ಇರೋ ಪಾರ್ಟಲ್ಲೇ there are two chambers. Okay, so that is posterior chamber, this is posterior chamber. Okay, and this is anterior chamber. Okay, ಇದನ್ನು ಯಾವತ್ತೂ ಕನ್ಫ್ಯೂಸ್ ಮಾಡ್ಕೋಬೇಡಿ. This is anterior chamber and this is posterior chamber. Okay, so this is vitreous humor will be there, and this is a posterior part. Okay, that is not chamber. Chamber anta bantu andre it is in front of the lens, always remember this. So there will be ciliary processes which will produce aqueous humor from here. Okay, idu whatever the gap is there in between the iris, that itself is pupil. Okay, so whatever the fluid or aqueous humor is produced from these ciliary processes, it will reach the posterior chamber, and then through the iris it will reach the anterior chamber. That itself has been depicted in this diagram also. So here these veins are nothing but the ciliary processes, and from here aqueous humor is produced, and through the posterior chamber, through iris or through pupil, it is reaching the anterior chamber. Okay, so and it will spread throughout here. Okay, after this there is an angle at which there is opening of this trabecular meshwork. Okay, yeah. So once the ciliary processes produces this, aqueous will be there in the posterior chamber. Through the pupil it will reach the anterior chamber, and from the anterior chamber there is two pathways for the aqueous humor to get drained out. It can go out through trabecular meshwork or it can go out through ciliary body. Okay, so this trabecular meshwork has a canal called as Schlemm's canal through which aqueous humor is drained, and this will ultimately form a collector channels, and most of the, that is 90% of the outflow is through this trabecular outflow. Okay, that is this one. Okay, 90%. Rest of the 10% it will reach the suprachoroidal space, and from there it will reach the venous circulation of the ciliary body or choroid and sclera, and then it will drain out. This is called as uveoscleral outflow. Okay, so trabecular meshwork is the major one. So remember this pathway. Ciliary processes will produce, from there it will reach posterior chamber, and then through pupil it will reach anterior chamber, and then it will divide into trabecular meshwork and ciliary body. Trabecular meshwork 90%, 10% is through uveoscleral outflow. Okay, after understanding this, we can understand open angle glaucoma. So if there is obstructed trabecular meshwork, okay, ಏನಾಗುತ್ತೆ, ಫ್ಲೂಯಿಡ್ ಟ್ರಾಬೆಕ್ಯುಲರ್ ಮೆಶ್ವರ್ಕ್ ಇಂದ ಒಳಗೆ ಬರಲ್ಲ, ಸೊ ಕಣ್ಣೊಳಗೆ ಉಳ್ಕೊಳ್ಳುತ್ತೆ, ಆ್ಯಂಡ್ ದ್ಯಾಟ್ ವಿಲ್ ಸ್ಟಾರ್ಟ್ ರೇಸಿಂಗ್ ದ ಪ್ರೆಷರ್, ದ್ಯಾಟ್ ಇಸ್ ಕಾಲ್ಡ್ ಆಸ್ ಇಂಟ್ರಾಕ್ಯುಲರ್ ಪ್ರೆಷರ್. ಸಿಂಪಲ್ ಅಲ್ಲ? ಅದರ್ ದೆನ್ ದಟ್ drainage canal can be obstructed or it can be blocked because of some other reasons. Ultimately it will lead to open angle glaucoma. Okay, so again, just like I said, what is the classification? It can be primary glaucoma, that is primary open angle, or primary angle closure. Okay, secondary andre there is some other cause. Primarily we don't know the cause actually, ಆಯ್ತಾ? Cause not known ಇದ್ರೆ ಅದು primary. If there is a secondary cause like trauma, ಇವಾಗ ಟ್ರಾಮಾ ಇಂದಾಗ ಏನಾಗುತ್ತೆ, ಟ್ರಾಬೆಕ್ಯುಲರ್ ಮೆಶ್ವರ್ಕಿಗೆ ಟ್ರಾಮಾ ಆಯಿತು, ದೇರ್ ಇಸ್ ಡ್ಯಾಮೇಜ್ ಆಫ್ ದ ಟ್ರಾಬೆಕ್ಯುಲರ್ ಮೆಶ್ವರ್ಕ್, ಆರ್ ದೇರ್ ಈಸ್ fibrosis of the trabecular meshwork, or if there is inflammation or steroid use or pigment dispersion or neovascularization, for some reason there is blockage of trabecular meshwork or uveoscleral outflow, then that will lead to secondary glaucoma. Like we can identify the cause, and if it is present since birth, then it is a congenital glaucoma due to developmental anomalies. Okay, so this is the classification, like primary open angle and primary angle closure. We will come to that. What is primary open angle and what is primary angle closure? Okay, so before that we will discuss the risk factors. There is elevated intraocular pressure as the person ages, that is more than 40 years, and usually a family history of glaucoma is there, then it is a risk factor. Other than that, all those short-sightedness, like we can see the images which are near to us but can't see images far to us. What usually we students will have, we will not be able to see board which is at a long distance, so that is called as myopia. Okay, that is short sightedness. We will be usually wearing concave lenses, and then this myopia is a risk factor for developing primary open angle glaucoma. And similarly opposite of that, that is hyperopia is for primary angle closure glaucoma. Other than that, diabetes, hypertension, vasospastic disorders, all these are risk factors for development of glaucoma. Prolonged corticosteroid use shouldn't be forgotten. Okay, so these are the risk factors for developing glaucoma. Again, coming to aqueous humor dynamics, just what we discussed before in a better 3D image. Okay, so these are the ciliary processes from where aqueous humor is produced, and from there through the pupil it will reach anterior chamber, and then it will disperse. There is two possible mechanism. One is through Schlemm's canal, that is trabecular meshwork, trabecular meshwork, and other one is Schlemm's canal, like which is a canal here. From these canal it will reach episcleral vein, and from there it will reach systemic veins. This is uveoscleral drainage route. Okay, if there is any obstruction here in the trabecular meshwork or in the Schlemm's canal, that will lead to raised intraocular pressure leading to glaucoma. Okay, so this was about aqueous humor outflow or dynamics. Or there can be one is obstruction. Okay. Other than that, if there is increased secretion of this aqueous humor, that will also lead to increased IOP. ಸೊ ಮೇನ್ಲಿ ಎಷ್ಟು ಸೆಕ್ರೇಟ್ ಆಗುತ್ತೆ ಅಷ್ಟು ಡ್ರೈನ್ ಆಗಬೇಕು. ಇಫ್ ದೆರ್ ಈಸ್ ಎನಿ ಇಂಬ್ಯಾಲೆನ್ಸ್ ಬಿಟ್ವೀನ್ ಸೆಕ್ರೇಷನ್ ಆಫ್ aqueous humor and drainage of aqueous humor, that will lead to increased intraocular pressure, in turn leading to glaucoma. Okay. Now again pathogenesis. ಏನಾಗುತ್ತೆ ಆ್ಯಕ್ಚುಲಿ ಮೆಕ್ಯಾನಿಕಲ್ ಥಿಯರಿ ಅಂತ ಒಂದು ಥಿಯರಿ ಇದೆ. ವಾಟ್ ಇಟ್ ಸೇಸ್, elevated intraocular pressure, whatever is happening because of increased aqueous humor, that will damage the optic nerve at the lamina cribrosa. Okay, this is mechanically damaging. Like pressure ಜಾಸ್ತಿ ಮಾಡಿದರೆ ಇವಾಗ because of pressure it is undergoing damage. So this is mechanical theory. What other theory says, it is a vascular theory. Like because of increased intraocular pressure, all these blood vessels will be compressed, and because of that reason there will be ischemia of optic nerve. So optic nerve ಗೆ ಕರೆಕ್ಟಾಗಿ ಬ್ಲಡ್ ಸಪ್ಲೈ ಆಗ್ತಾ ಇಲ್ಲ, and because of this reason there will be poor perfusion to optic nerve head, and that will lead to damage or vision loss. Okay, so ಮೆಕ್ಯಾನಿಕಲ್ ಥಿಯರಿ ಗೊತ್ತಾಯಿತು. ಡ್ಯಾಮೇಜ್ ಆಗಿದೆ ಅಂದರೆ ಲ್ಯಾಮಿನಾ ಕ್ರಿಬ್ರೋಸದಲ್ಲಿ ಮೆಕ್ಯಾನಿಕಲಿ ಇಟ್ ಈಸ್ ಅಬ್ಸ್ಟ್ರಕ್ಟಿಂಗ್ ಅಂತ, ಇಟ್ ಈಸ್ ಕಾಸಿಂಗ್ ಡ್ಯಾಮೇಜ್. ವ್ಯಾಸ್ಕ್ಯುಲರ್ ಥಿಯರಲ್ಲಿ ವ್ಯಾಸ್ಕ್ಯುಲರ್ ಬ್ಲಡ್ ಸಪ್ಲೈ ಏನಿತ್ತು ಅದು ಬ್ಲಾಕ್ ಆಗಿದೆ, ಹಾಗಾಗಿ there is damage or glaucoma. Okay, other theory says neurodegenerative theory, that is what we discussed in the definition. Like ganglion cells ಏನಿದೆ, retinal ganglion cells, ಅದು ತನ್ನಷ್ಟಕ್ಕೆ ತಾನೇ ಅಪೋಪ್ಟೋಸಿಸ್ ಆಗ್ತದೆ, like programmed cell death. There is no actual risk factor, or we don't know why exactly it is happening, but there is apoptosis of these ganglion cells due to multiple cellular and molecular mechanisms, and because of that reason there is development of glaucoma. Okay, so these are the three theories. What is the clinical feature? ಪ್ರೈಮರಿ ಓಪನ್ ಆ್ಯಂಗಲ್ ಗ್ಲೋಕೋಮಾದಲ್ಲಿ ಏನಿರುತ್ತೆ ಫೀಚರು, ಯೂಶಲಿ ದಿಸ್ ಇಸ್ ಇನ್ಸಿಡಿಯಸ್ ಇನ್ ಆನ್ಸೆಟ್. ಯಾವಾಗ ಶುರುವಾಗುತ್ತೆ ಅಂತ ಗೊತ್ತಾಗಲ್ಲ, ಪೇಯ್ನ್ ಇರಲ್ಲ, ಏನಿರಲ್ಲ, ಬೈಲ್ಯಾಟ್ರಲ್ ಎಸಿಂಪ್ಟಮ್ಯಾಟಿಕ್ ಇನಿಷಿಯಲಿ, ಗ್ರ್ಯಾಜುವಲಿ ಪೆರಿಫೆರಲ್ ವಿಷನ್ ವಿಲ್ ಬಿ ಗೆಟಿಂಗ್ ಲಾಸ್ಟ್. ಓಕೆ, ಸೊ ಇಫ್ ಯು ಆರ್ ಏಬಲ್ ಟು ಸಿ ದಿಸ್ ಮಚ್ ನಾರ್ಮಲಿ, in as the glaucoma progresses, peripherally you will not be able to see whatever I am marking in yellow, you won't be able to see. This is called as tunnel vision. So ultimately as the glaucoma progresses, the person will be able to see only this much. So tunnel ತರ ಇಷ್ಟೇ ಮಾತ್ರ ನೋಡೋಕ್ಕಾಗುತ್ತೆ. So this is called as tunnel vision. So as the disease progresses in primary open angle glaucoma, tunnel vision will happen. In case of primary acute or angle closure glaucoma, okay, angle closure glaucomaದಲ್ಲಿ ಏನಾಗುತ್ತೆ, there will be sudden onset of pain, redness, headache, nausea, vomiting, blurred vision, halos around the lights, everything. So this is actually treated like emergency. Okay, so ಇಲ್ಲಿ ಬೇಸಿಕಲಿ ಮೆಕ್ಯಾನಿಸಮ್ ಏನಾಗ್ತಿದೆ, ಓಪನ್ ಆ್ಯಂಗಲ್ ಕ್ಲೋಸ್ ಆ್ಯಂಗಲ್ ಯಾವ ಆ್ಯಂಗಲ್ ಬೇಸ್ ಮೇಲೆ ಹೇಳ್ತಿದ್ದೀವಿ ಅಂದರೆ, ದಿಸ್ ಆ್ಯಂಗಲ್ ಬಿಟ್ವೀನ್ the sclera or cornea and between the iris. Okay, so this is the exact angle. So in angle closure glaucoma, there will be closure of this angle. ಏನಾಗುತ್ತೆ, ಇಂಟ್ರಾಕ್ಯುಲರ್ ಪ್ರೆಷರ್ ರೈಸ್ ಆಗಿದೆ, ರೈಟ್, and this iris will be pushed forward now, and because of this forward movement of iris, this will come like this, and there will be obstruction of this angle. Okay, so ಇಲ್ಲಿ ಎಷ್ಟೊಂದು 60 degrees ಅಷ್ಟಿತ್ತು ಅಂದರೆ ಇಲ್ಲಿ it has reduced because of forward movement of iris. This is called as angle closure glaucoma. The angle is getting closed because of forward pushing of iris, and because of this reason there will be pain, redness, itching, colored halos, everything. Okay, so angle closure glaucomaದಲ್ಲಿ ಏನಾಗ್ತಿದೆ, there is pushing or forward movement of this iris, and because of that reason there will be closing of this angle, and that is leading to impaired obstruction, because here is the region where there is trabecular meshwork. Trabecular meshwork ಇಲ್ಲೇ ಇರೋದು. ಆ್ಯಂಗಲ್ ಕ್ಲೋಸ್ ಆಗೋದ್ರಿಂದ ಏನಾಗುತ್ತೆ, there will be difficulty for aqueous humor to come into this region, and because of that reason there will be impaired drainage, so more aqueous humor in the eye and leading to intraocular pressure. Okay, but in case of open angle glaucoma, the angle is normal, there is no problem with the angle, but there is problem with trabecular meshwork, like we have discussed, obstruction ಆಗಿರ್ಬೋದು ಅಥವಾ problem with UVS scleral outflow. ಆ ಥರ ಏನೋ ಪ್ರಾಬ್ಲಮ್ ಅದರ್ ದ್ಯಾನ್ ದಿಸ್ ಆ್ಯಂಗಲ್ ಬೀಯಿಂಗ್ ನಾರ್ಮಲ್, ದ್ಯಾಟ್ ಈಸ್ ಕಾಲ್ಡ್ ಆಸ್ normal primary open angle glaucoma. And here this is a gradual process. A trabecular meshwork obstruction ಆಗಕ್ಕೆ ಏನೋ ಒಂದು ಆಗಕ್ಕೆ it will take a long time. It will be bilateral and asymptomatic. Okay, that is a major difference between primary open angle glaucoma and primary closed angle glaucoma. Okay, closed angle glaucomaದಲ್ಲಿ ಪೇನ್ ಇರುತ್ತೆ, ಇಮ್ಮಿಡಿಯೇಟ್ ಅಕ್ಯೂಟ್ ಆನ್ಸೆಟ್ ಸಡನ್ ಆಗುತ್ತೆ, ಬಟ್ ದಿಸ್ ಇಸ್ ಪೇನ್ಲೆಸ್ ಆ್ಯಂಡ್ ಇಟ್ ಈಸ್ ಇನ್ಸಿಡಿಯಸ್ ಇನ್ ಆನ್ಸೆಟ್ everything. And this primary open angle glaucoma is more common than primary angle closure glaucoma. Okay, and this disease there is no proper permanent cure, hence earlier the identification, better will be the prognosis. Okay, how will we diagnose this? We will measure intraocular pressure. Intraocular pressure measure ಮಾಡಕ್ಕೆ there is an instrument called as tonometer which measures the intraocular pressure. Other than that, gonioscopy is also used. Okay, this what does this gonioscopy will actually do? It will measure the angle of the anterior chamber, whatever the angle we are speaking, angle closure glaucoma na open angle glaucoma na anta identify ಮಾಡಕ್ಕೆ gonioscopy can be done. Other than that, fundoscopy can be done to see optic disc cupping, because we studied ಏನಾಗುತ್ತೆ retinal cells of optic or retina ಅದು nerves cells ಮತ್ತೆ ganglion cells and their axons are getting damaged, that is ultimately leading to optic nerve head changes ಅಲ್ವಾ. ಸೊ ಆಪ್ಟಿಕ್ ನರ್ವ್ ಹೆಡ್ಡಲ್ಲಿ ಚೇಂಜ್ ಆಗಿದೆ ಅಂತ ನೋಡೋಕ್ಕೆ ಏನು ಮಾಡಬೇಕು, ಫಂಡೋಸ್ಕೋಪಿ ಮಾಡಿ ಆಪ್ಟಿಕ್ ಡಿಸ್ಕ್ ಕಪ್ಪಿಂಗ್ ಇದೆಯಾ ನೋಡಬೇಕು. ಕಪ್ಪದು ಡಿಸ್ಕ್ದು ರೇಷಿಯೋ ಆಪ್ಟಿಕ್ ಕಪ್ ಅಂತ ಒಂದು ಬರುತ್ತೆ, ಅದ್ರ ಸುತ್ತ ಆಪ್ಟಿಕ್ ಡಿಸ್ಕ್ ಇರುತ್ತೆ. ಸೊ ಕಪ್ ಆ್ಯಂಡ್ ಡಿಸ್ಕ್ ಇಮ್ಯಾಜಿನ್ ಲೈಕ್ ದಿಸ್. ಸೊ ಕಪ್ಪಿಗೂ ಡಿಸ್ಕಿಗೂ ರೇಷಿಯೋ ಮೋರ್ ದೆನ್ 0.6 ಇರಬೇಕು, ಇಷ್ಟು ಸಣ್ಣ ಇರಬಾರ್ದು. ಐ ಮೀನ್ ಸಣ್ಣ ಇರಬೇಕು. ಇಫ್ ಇಟ್ ಈಸ್ ಮೋರ್ ದೆನ್ 0.6, ಇಫ್ ದ ಕಪ್ ಹ್ಯಾಸ್ ಬಿಕಮ್ ಮೋರ್ then 0.6. So ivagidu optic cup, the optic disc, sorry, this is cup, this is disc. Okay, if the cupping has becoming, I mean it is becoming large day by day, then it is a sign of glaucoma. This optic cup to disc ratio is measured by fundoscopy. Okay, other than that, visual field testing like arcuate scotomas enadru idya, nasal steps, tunnel vision, ಪೆರಿಫೆರಿಯಲ್ ಕೈ ಇಟ್ಕೊಂಡ್ಬಿಟ್ಟು ಇದು ಕಾಣಿಸ್ತಿದೆಯಾ ಅಂತ ಕೇಳ್ಕೊಂಬರೋದು. ಇಫ್ ದೇರ್ ಇಸ್ ಟನಲಿಂಗ್ ಆಫ್ ದ ವಿಷನ್, ದ ಪೇಷಂಟ್ ವೋಂಟ್ ಬಿ ಏಬಲ್ ಟು ಸಿ ಫ್ರಮ್ ವಾಟ್ ಎವರ್ ಇಸ್ ದೇರ್ ಆನ್ ಹಿಸ್ ಸೈಡ್, ಬಟ್ ಹಿ ವಿಲ್ ಬಿ ಏಬಲ್ ಟು ಸಿ ಓನ್ಲಿ ಇನ್ ಫ್ರಂಟ್ ಆಫ್ ಹಿಸ್ ಐಸ್. ಓಕೆ, ಅದರ್ ದನ್ ದಟ್ ವಿ ಕ್ಯಾನ್ ಗೋ ಫಾರ್ OCT, just like a CT scan of our brain. It is optimal coherence tomography, from which we will be able to see all the layers of the retina. Okay, and if there is retinal layer thinning, then we will be able to identify it based on OCT. So this is how tonometry is performed, okay, to measure intraocular pressure. Okay, so how will we manage glaucoma? Management is basically medical. Okay, medically ಹಿಂಗೆ ಮ್ಯಾನೇಜ್ ಮಾಡ್ತೀವಿ. We will use various drugs. So basically you can say, ಇವಾಗ ಏನಕ್ಕೆ ಆಗ್ತಾ ಇದೆ ಕಾಸ್ ಗೊತ್ತಿದೆ ನಮಗೆ. ಸೊ trabecular outflow is hampered. ಸೊ ಇನ್ಕ್ರೀಸ್ ಮಾಡಿದರೆ trabecular outflowನ, there will be drainage of the aqueous humor, and because of that reason there will be reduced intraocular pressure. One, okay. Other than that, increase UVS scleral flow. UVS scleral flow should be increased, and again because of this reason 10% whatever is there, that will be drained, and again that will also bring down intraocular pressure. Okay, so these were the two. If there is excessive secretion, outflow ಅಲ್ಲಿ ಏನೋ ಪ್ರಾಬ್ಲಮೇ ಇಲ್ಲ, ಬಟ್ ಸೆಕ್ರೇಷನ್ ಜಾಸ್ತಿ ಆಗಿದ್ರೆ, ಅಗೇನ್ ಯು ಕ್ಯಾನ್ ಡಿಕ್ರೀಸ್ ದ ಸೆಕ್ರೇಷನ್ ಬೈ ಗಿವಿಂಗ್ ಸರ್ಟನ್ ಡ್ರಗ್ಸ್, ಅಗೇನ್ ದಟ್ ವಿಲ್ ಟ್ರೀಟ್ glaucoma. So these are the main 3 principles we will use in pharmacological management of glaucoma, by reducing the trabecular outflow, or by increasing the trabecular outflow, or by increasing the UVS scleral outflow, or by decreasing the secretion. So there are certain drugs for all this. We will see one by one. So what are the drugs for increasing trabecular outflow? That is parasympathetic agents, parasympathomimetic agents. Okay, prostaglandin analogs can be used, and rho kinase inhibitors can be used. Okay, other than that, to increase UVS scleral outflow, again prostaglandin analogs can be used, and alpha agonists can be used. Okay, for decreasing aqueous humor production, beta blockers, alpha agonists, and carbonic anhydrase inhibitors. So we will study them one by one. Yeah, So prostaglandin analogs we will be using for increasing the outflow through the uveoscleral pathway. That is bimatoprost, latanoprost. Usually we will use latanoprost. Okay, this is PGF2 alpha analog. Okay, so this will bring about uveoscleral outflow, and then it is used usually one time daily, typically at the before going to bed. What are the adverse effects andre PGF2 indane PGF alla ನೆನಪಿಟ್ಕೋಬಹುದು. So P for pigmentation. Okay, so iris ಅಲ್ಲಿ blackish pigmentation ಆಗಕ್ಕೆ ಶುರುವಾಗುತ್ತೆ. G for growth of eyelashes, that is called as hypertrichosis. Other than that, you can remember macular edema also for fluid. F andre fluid, maculaದಲ್ಲಿ fluid accumulation ಆಗುತ್ತೆ, and that will lead to edema, macular edema. So these are the side effects of latanoprost, you can say, or prostaglandin analogs. Okay, so other than that, for increasing the trabecular outflow, we will use parasympathomimetics or cholinergics like pilocarpine. These will be usually used 3 to 4 times daily. And what are the side effects? Blurred vision, poor night vision, eye pain and headache. Okay, other than that, there are more drugs for reducing the aqueous humor production. So like alpha adrenergic agents, agonists, okay, or beta blockers, or carbonic anhydrase inhibitors. Okay, so basically aqueous humor ಎಲ್ಲಿಂದ ಬರ್ತಿದೆ? ciliary process, that is nothing but a blood vessel. So blood vessel constrict ಆಗಂಗೆ ಮಾಡಿದರೆ aqueous humor production ಕಮ್ಮಿ ಆಗುತ್ತೆ. ಅದಕ್ಕೆ we will use all these blood vessel constrictors like alpha adrenergic agonists. So alpha adrenergic agonist ನಮಗೆ ಗೊತ್ತಿರಂಗೆ alpha 1, it will cause vasoconstriction ಅಲ್ಲ in eye. So these are the receptors present in eye. Okay, so this will bring about vasoconstriction. Vessels constrict ಆಯ್ತಂದ್ರೆ aqueous humor production ಜಾಸ್ತಿ ಆಗಲ್ಲ. So hence we are meeting our requirement. So alpha adrenergic agonist decreases the aqueous humor production. Examples: apraclonidine and brimonidine. So these will be used 2 to 3 times daily. What are the side effects? Ocular allergy ಆಗ್ಬೋದು, bitter taste, dry mouth, systemic hypotension cause ಮಾಡ್ಬೋದು, or irregular heart rates. Okay, beta blockers will also be used to decrease aqueous humor production because alpha 1 and beta 2 have opposite actions. Alpha 1 will cause vasoconstriction, beta 2 will cause vasodilation. So we have to block vasodilation and permit vasoconstriction. Same thing we are doing. We are using alpha agonists, beta 2 antagonists or beta blockers. ಗೊತ್ತಾಯ್ತಲ್ವಾ? ಅಷ್ಟೇ ಸಿಂಪಲ್ ಮೆಕ್ಯಾನಿಸಮ್. ಸೊ ಬೀಟಾ ಬ್ಲಾಕರ್ಸ್ ಯಾಕೆ ಯೂಸ್ ಮಾಡ್ತಿದ್ದೀವಿ? ವ್ಯಾಸೋಡೈಲೇಷನ್ ಕಾಸ್ ಮಾಡುತ್ತೆ ಬೀಟಾ 2 in eye. So we are blocking that so that there will be vasoconstriction and less aqueous humor is produced. Examples: bitoxolol, cartenolol, livobunolol, metoprolol, timolol. Basically timolol you can usually see everywhere in the wards. Okay, 1 to 2 times daily use ಮಾಡ್ತೀವಿ. Avoid night time administration. And other causes like beta is present in, one is in heart and 2 is in lungs. So there can be bronchospasm or there can be bradycardia because heart and lungs ಮೇಲೂ ಆ್ಯಕ್ಟ್ ಆಗುತ್ತಿದ್ದು ಸಿಸ್ಟಮಿಕಲ್ಲೇ ಕೊಟ್ಟರೆ. ಓಕೆ, ಸೊ ಬಿಕಾಸ್ ಆಫ್ ದ್ಯಾಟ್ ರೀಸನ್ ದೀಸ್ ಸೈಡ್ ಎಫೆಕ್ಟ್ಸ್ ಶುಡ್ ಬಿ ಕನ್ಸಿಡರ್ಡ್. ಓಕೆ, ಅದರ್ ದನ್ ದಿಸ್ there can be other side effects also like ocular dryness. Then carbonic anhydrase inhibitors, these decreases aqueous humor production. Basically this acts like a diuretic, you can say. Okay, brinzolamide, dorzolamide ಇವೆಲ್ಲ ಡಯೂರೆಟಿಕ್ಸೇ. ಕಾರ್ಬೋನಿಕ್ ಆ್ಯನ್ಹೈಡ್ರೇಸ್ PCTL ಆ್ಯಕ್ಟ್ ಮಾಡುತ್ತಲ್ಲ ಅದೇ ಥರನೇ ಹಿಯರ್ ಇಟ್ ವಿಲ್ ಡಿಕ್ರೀಸ್ ದ aqueous humor production. 2 times daily ಯೂಸ್ ಮಾಡ್ತೀವಿ. ಆಕ್ಯುಲರ್ ಇರಿಟೇಷನ್ ಆ್ಯಂಡ್ ಸೋರ್ ಟೇಸ್ಟ್ is the side effects. So this was about drugs used in management of glaucoma basically. So this was about medical management. Medically ಟ್ರೀಟ್ ಮಾಡೋಕ್ಕಾಗಲ್ಲ ಅಂದರೆ ಏನಾದರೂ ಸರ್ಜಿಕಲ್ ಆಪ್ಷನ್ಸ್ ಇದೆಯಾ ಅಂದರೆ ಲೇಸರ್ ಆಪ್ಷನ್ಸ್ ಇದೆ. ಲೈಕ್ ಲೇಸರ್ ಟ್ರಾಬೆಕ್ಯುಲೋಪ್ಲಾಸ್ಟಿ ಅಂದರೆ ಏನಾಗಿದೆ, ಇವಾಗ ಟ್ರಾಬೆಕ್ಯುಲರ್ ಮೆಶ್ ವರ್ಕ್ ಹಿಂಗಿದೆ, ಮೆಶ್ ವರ್ಕ್ ಥರನೇ ಇರುತ್ತೆ ಇದು. ಓಕೆ, ಸೊ ದಿಸ್ ಮೆಶ್ ವರ್ಕ್ ಥರ ಇದ್ದು ಇಲ್ಲಿ ಏನಾದ್ರು ಬ್ಲಾಕೇಜ್ ಆಗಿದ್ದರೆ ಲೇಸರ್ ಯೂಸ್ ಮಾಡಿ ವಿ ವಿಲ್ ಬರ್ಸ್ಟ್ ದಿಸ್ ಬ್ಲಾಕೇಜ್. ದ್ಯಾಟ್ ಈಸ್ ಕಾಲ್ಡ್ ಎಸ್ ಟ್ರಾಬೆಕ್ಯುಲೋಪ್ಲಾಸ್ಟಿ. ಆಮೇಲೆ ವಿ ಕ್ಯಾನ್ ಪುಟ್ ಅ ಮೆಶ್, ಸಿಂಥೆಟಿಕ್ ಮೆಶ್, ದಟ್ ಈಸ್ ಪ್ಲಾಸ್ಟಿ. ಸೊ ದಿಸ್ ಈಸ್ ಓನ್ಲಿ ಡನ್ ಫಾರ್ ಪ್ರೈಮರಿ ಓಪನ್ ಆ್ಯಂಗಲ್ ಗ್ಲೋಕೋಮಾ ಬಿಕಾಸ್ ಆ್ಯಂಗಲ್ ನಾರ್ಮಲ್ ಇದೆ, ಟ್ರಾಬೆಕ್ಯುಲರ್ ಮೆಶ್ ವರ್ಕಲ್ಲಿ ಏನೋ ಪ್ರಾಬ್ಲಮ್ ಇದೆ, ಅದಕ್ಕೆ ಟ್ರಾಬೆಕ್ಯುಲರ್ ಮೆಶ್ ವರ್ಕ್ನ ಟ್ರೀಟ್ ಮಾಡ್ತೀವಿ. ಓಕೆ, ಆ್ಯಂಡ್ ದೆನ್ ಲೇಸರ್ ಪೆರಿಫೆರಲ್ ಐರಿಡಾಟಮಿ ಅಂದರೆ ಐರಿಸ್ ಮುಂದೆ ಬಗ್ಗಿದೆ ಅಲ್ವಾ, ಆ ಐರಿಸ್ನ ಸುಟ್ಬಿಟ್ಟು ಓಪನ್ ಮಾಡೋದು ಲೇಸರಲ್ಲಿ. ಸೊ ಲೇಸರಲ್ಲಿ ವಿ ವಿಲ್ ಕ್ರಿಯೇಟ್ ಅನ್ ಓಪನಿಂಗ್ ಥ್ರೂ ದಿಸ್ ಐರಿಸ್ ಸೊ ದಟ್ ವಾಟ್ ಎವರ್ ದ ಫ್ಲೂಯಿಡ್ ಇಸ್ ದೇರ್ ದ್ಯಾಟ್ ವಿಲ್ ಪಾಸ್ ಥ್ರೂ ದಿಸ್ ಹೋಲ್ ಇನ್ ದ ಐರಿಸ್. ಸೊ ದ್ಯಾಟ್ ಈಸ್ ಪೆರಿಫೆರಲ್ ಐರಿಡಾಟಮಿ. ಓಕೆ, ಯೂಸಿಂಗ್ ಲೇಸರ್. This is done for angle closure glaucoma. Surgically we can go for removal of this trabecular meshwork also called as trabeculectomy, which will be, and after this trabecular meshwork is removed, we will put a synthetic tube like canal like thing. Okay, so they are called as glaucoma drainage devices. So meshwork ತೆಗೆದು synthetic drainage device na ಅಥವಾ valve implants na we can put. This will serve the purpose. So this was about management. ಟ್ರೀಟ್ ಮಾಡಿಲ್ಲ ಗ್ಲೋಕೋಮಾ ಅಂದರೆ ಏನಾಗುತ್ತೆ, ಇರ್ರಿವರ್ಸಿಬಲ್ ಬ್ಲೈಂಡ್ನೆಸ್ ಆಗುತ್ತೆ. ಒಂದು ಸಲ ಬ್ಲೈಂಡ್ನೆಸ್ ಬಂತಂದರೆ ವಿ ಕಾಂಟ್ ರಿವರ್ಸ್ ಇಟ್. ಸೊ ಏನೇ ಆಟ ಇದ್ದರೂ ಬಿಫೋರ್ ಬ್ಲೈಂಡ್ನೆಸ್ ಅಪಿಯರ್ಸ್. ಓಕೆ, ಆ್ಯಂಡ್ ಪೋಸ್ಟ್ ಸರ್ಜಿಕಲ್ ಕಾಂಪ್ಲಿಕೇಶನ್ಸ್ ಏನೇನಾಗ್ಬೋದು, ಟೋನ್ ತುಂಬ ಕಮ್ಮಿ ಆಗಿಬಿಡ್ಬೋದು. ಇನ್ಕ್ರೀಸ್ಡ್ ಇಂಟ್ರಾಕ್ಯುಲರ್ ಪ್ರೆಷರ್ ಇತ್ತು, ಅದ್ರ ಬದಲು ಫುಲ್ ಡಿಕ್ರೀಸ್ಡ್ ಇಂಟ್ರಾಕ್ಯುಲರ್ ಪ್ರೆಷರ್, ಹೈಪೋಟೋನಿ ಆಗುತ್ತೆ. ಅದರ್ ದನ್ ದಟ್ ಇನ್ಫೆಕ್ಷನ್ ಆಗ್ಬೋದು, ಇಲ್ಲ ಕೆಟ್ರಾಕ್ಟ್ ಆಗ್ಬೋದು. ಓಕೆ, ಸೊ ದೀಸ್ ಆರ್ ದ ಕಾಂಪ್ಲಿಕೇಶನ್ಸ್. Prognosis and follow-up, lifelong disease requiring regular monitoring of IOP, visual fields and optic nerve status. Okay, good prognosis is detected if detected early and treated adequately. So this was about glaucoma.